Bismillahirrahmanirrahim. Welcome to my video presentation. My presentation topic: Assignment on Dexagen. Submitted to Tahmina Afroz, Lecturer, Department of Pharmacy, Faculty of Allied Health Sciences, Daffodil International University. Submitted by Khondokar Mohammad Rehanuddin, ID 203294113, Department of Pharmacy, Daffodil International University. First of all, we see some indications. I. Dexamethasone phosphate is indicated for treatment of steroid-responsive inflammatory conditions of the conjunctiva, cornea, and anterior segment of the eye, such as anterior uveitis, iritis, cyclitis, allergic and vernal conjunctivitis, herpes zoster keratitis, superficial punctate keratitis, and non-specific superficial keratitis. Then we see the indications of ER. Indicated in the steroid responsive inflammatory conditions of the external auditory meatus, such as allergic otitis externa, selected purulent and non-purulent effective otitis externa. Therapeutic class: oral steroid and antibiotic combined preparations, ophthalmic non-steroid drugs, ophthalmic steroid preparations. Pharmacology: Dexamethasone is a synthetic glucocorticoid which decreases inflammation by inhibiting the migration of leukocytes and reversal of increased capillary permeability. It suppresses normal immune response. Now we are talking about dose and administration. I. As 0.1% drop, the frequency of installation of drops and the duration of treatment will vary depending upon the severity of underlying conditions and the response to treatment. When a favorable response has been observed, reduce the dose towards 1 drop every 4 hours. As 0.05% ointment, apply 0.5 to 1 inch rebound of ointment into the conjunctival sacs up to 4 times daily. Reduce to once daily dosing when condition has improved. ER. Instill 2 or 3 drops to the ear at 2 or 3 hour interval. The frequency of dose and duration of the treatment may vary with the type of lesion and severity. Interaction: non-relevant to topical use. Contraindications: epithelial herpes simplex, keratitis, acute infections, stages of vaccinia, varicella, and many other viral diseases of the cornea and conjunctiva. Mycobacterial infection of the eye, fungal disease of ocular or ocular structures, perforation of a drum membrane, hypersensitivity to any ingredient of this product. Now we are talking about side effects. Glaucoma with optic nerve damage, visual acuity and field defects, posterior subcapsular cataract formation, secondary ocular infection from pathogens including herpes simplex, perforation of the globe. Rarely, staining and burning may occur. Pregnancy and lactation. Pregnancy category C, there is no adequate and well-controlled studies in pregnant women. This drug should be used during pregnancy only if the potential benefit justifies the potential risk to the fetus. Lactation. Caution should be exercised when dexamethasone ophthalmic solution is administered to a nursing woman. Precautions and warnings. The possibility of persistent fungal infections of the cornea should be considered after prolonged corticosteroid dosing. There have been reports of bacterial keratitis associated with the use of multiple dose containers of topical ophthalmic products. These containers had been inadvertently contaminated by patients who, in most cases, had a concurrent corneal disease or a disruption of the ocular epithelial surface. Use in populations. Pediatric use. Safety and efficiency is pediatric patients below the age of 18 have not been established. Overdose effects. Long-term intensive topical use may lead to systemic effects. Oral ingestion of the contents of the bottle up to 10 ml is unlikely to lead to any serious adverse effect. Storage conditions. Store below 30 degrees Celsius in a cool and dry place protected from light. Keep out of reach of children. Do not touch the dropper tip to surface since this may contaminate the solution. Do not use after 30 days for first opening. Thank you everyone. Thank you for listening me with patience.